All right, and welcome Mr. Dave Hewitt from Adaptive, it's
Prosthetics. Yep.
and he's going to give a presentation about what he does for a living and give us a lot of good examples. And we're going to be an engaged, awesome class. It looks like there's a lot of show and tell.
Yep. I'm pretty laid back in the presentation, so if you think of something, go ahead and interrupt me. My goal is for you to leave here seeing a career or something that might spark your interest. I started the practice I currently have in '97. Prior to that, I worked for a nonprofit hospital. And prior to that, I was an aircraft mechanic. So what I'm getting at is, what I'd like to see you guys do is pursue a career, whatever it is, pick something you think you like. If you get into it and you don't like it, it's all right. You can change careers and do something else. I've done it, Jane's done it. But just keep moving forward. So I worked as an aircraft mechanic, very mechanical, liked fixing things, and that's kind of what this job entails. My sister's a nurse, and that's how I found out about this career, because I knew I was going to get laid off. Started looking at other careers, and that kind of set the wheels in motion to get retrained for this field. My schooling consisted of, for what I do, is usually an undergraduate degree and then some additional education on top of this. So it's a postgraduate program. I'll talk about some education avenues you can take if you want to do this field. So the definitions of what I do: a prosthetist is somebody that fits somebody with an artificial limb. So a part of the body that's missing. An orthotist is somebody that braces a component of the body, either to mobilize or protect it, such as a leg brace, a knee brace. That's what an orthotist does. And those kind of fields go hand in hand. We have similar patients, similar places that we work in. So the reasons for a need for our services probably fall into three categories. We have trauma, we have disease, and we have congenital. And congenital just means somebody's born that way. How about somebody throw out some ideas for trauma?
Car
accidents is a big one. Any type of motor vehicle. Motorcycles are famous for making people amputees. Do too well when it's motorcycle versus car. Lawnmower accidents. I've seen a lot of children, unfortunately, lose feet. I've seen propeller accidents, in the water with a boat. I've seen sharks. Yeah, that's been in the TV a lot. Trying to think what else. So if we go to disease, how about some diseases? People think of them?
Frostbite? Can you tell that we just read about frostbite and hypothermia?
Okay.
So both
Frostbite, damages the blood vessels and they die, and they often have to amputate that part of the limb. So we'll see feet, we'll see fingers and digits, sometimes frostbitten. I'm going to lead into that next with lifestyle. Congenital. A lot of times children are born missing limbs, and sometimes they can be, I worked at a children's hospital, as I mentioned, so I've seen a ton of this. That's what we did. Sometimes the limb would just stop growing for whatever reason at a joint. Sometimes they'd have what's called constriction bands, and literally they'd look like elastic bands around a limb. So you'd have this point here and then part of a hand that grew beyond, and it wasn't functional, so they'd have to amputate. Sometimes they were missing certain bones. A lot of times they'd be missing the fibula bone in the leg. And the rest of the foot and every structure was there, but it wasn't sufficient for weight bearing. So to make them able to ambulate and walk, they'd amputate that limb, make them a functional below the knee amputee, and they'd do fine. You also have being a nurse, I'm not sure if this would fall in congenital or trauma, like cerebral palsy. I mean, it's a trauma in birth.
Right.
So cerebral palsy,
Yeah.
sometimes the motor system from the brain to the muscles is damaged, so they may not be able to pick up their foot, pick up their leg, and that's where bracing may come in. Muscular dystrophy is another disease. MS, those come on later in life typically. So those, and then we get into risk factors. There's kind of 3 areas that broke it down: age, lifestyle, and race. And how about age? We'll start with that. Anybody have any ideas? The older we get, things will start to set in, like MS, I mentioned. And just joints wear out, things happen. I've seen plenty of people that might go in for surgery and infection develop. You know, the surgery was from old age, like knee joint replacement, for example. They go in and have a knee joint replaced, infection happens, if it's real bad, they have to amputate the limb to save their life. I see all the worst case scenarios. So when everyone comes to me and they want to go in for a surgical procedure, I'm like, stop, try not to, but that's just because I'm biased to it. So age could be one. The older we get, usually run into more problems with our health. How about lifestyle? You mentioned frostbite. Can you think of some reasons of lifestyle for frostbite?
So who would be likely to have frostbite? Somebody who's outside,
And live in cold places.
skiers, but is there anything else that might be on board with somebody with frostbite where they don't realize that they're cold? Lifestyle. Okay, I think they're not getting it.
Okay, how about a self-destructive lifestyle? Does that help?
Choices that adults can make after they turn age 21.
Drinking.
Yeah.
Or drugs?
Or
Yeah, I've
drugs.
seen both. I've seen several alcoholics pass out in cold weather conditions and lose limbs. I've had several people that OD'd and they passed out in a position. Most of the, for whatever reason, alcoholics seem to be outside, the drug abusers seem to be inside. So like, probably the couple extreme cases I've seen with drug abuse where people pass out is they pass out in a position lying on their body part for an extended period of time, and it cuts off the blood flow. I had a woman I worked with who passed out in a kneeling position, you know, on her knees, kind of like this position, passed out. Well, unfortunately, she had to have both limbs amputated above the knee because she cut off the blood flow. So those are kind of some lifestyle extremes that we see. One that's not as, I guess, extreme as that, but the same outcome, is smoking. Smoking destroys the little blood vessels far away from the heart and fingers, toes. And what happens is that it's called peripheral vascular disease sets in, and then they have to amputate because the blood flow isn't sufficient to the limbs that are furthest from the heart. So I see a lot of amputees because of that. Unfortunate, could have been prevented. Diabetes sometimes is lifestyle related. If we don't control our body weight, pancreas works overtime, and diabetes sometimes sets in. Not always, some of it's hereditary, but some of it can be controlled. So I've seen people successfully reverse the course of diabetes just by changing their diet and lifestyle. I mentioned race. What are some risk factors? What races are high risk factors for some of our services? Anybody know?
Did you hear?
I didn't see.
Don't they?
You can speak up. Yeah, they do
I
have.
said, don't African Americans have a higher risk of blood pressure, like high blood pressure?
Hypertension, yes. Diabetes. That's one. Another race. Okay. The other race is Hispanic. So they don't necessarily know why. I'm not an expert in this. I just know that those two, they have a higher incidence. Some of it could be dietary, they're not exactly sure, just the types of foods. So just something to be aware of. The history of prosthetics, I've unearthed some Egyptian mummies 3,000 years ago with prosthetics, so it's been around a long time. The advancements have come, unfortunately, usually due to wars that have occurred, because what happens is the Department of Defense has put a ton of money into prosthetic technology, and we've made some huge leaps from like Vietnam era to currently. They put a ton of money into research, and that's where some of these high-tech things have come out of. I'll talk about those later. So if we go into to prosthetics, so I mentioned some of the accidents, partial feet, would be lawnmowers and frostbite. Those are probably the number ones. But then the other one would be the disease related of diabetes, peripheral vascular disease, smoking. What happens is, a toe turns black, they go in to amputate, and then they just keep coming back. They have to amputate the limb far enough that the vascular supply is good enough so the tissue's healthy. Unfortunately, it kind of whittle away on those people. It's pretty sad. Transtibial or below the knee is a very typical one you'll see. They make a lot of press on TV, and guys can run and do some pretty amazing things. Your lifestyle's pretty normal if your amputation is below the knee. If you get above the knee, that gets quite different. But for a below the knee, I couldn't bring everything, guys. I'm sorry, but
This is great. I was gonna say.
a person that's missing their limb, you gotta realize the skeleton is gone. So we have to now, instead of taking that body weight through the tibia and fibula to the floor, we now have to take it on the soft tissue. Basically, the skin and muscles are taking all the weight. The body was never designed for that. But so what we'll do is we'll use an interface material. This is a silicone gel liner. It's very thick. The problem with the skin is every time somebody walks and moves, there's that friction, that force, and the skin breaks down, ulcers and things like that. So we have to use technology. This silicone technology's been out for, I don't know, 20 years or so. This has really changed the industry dramatically. So someone they'll roll this onto their limb, and then they will step into the socket, and it's broken here, but there's a pin on the end, a locking mechanism that locks it on, and that's how they hold it on. Very good design. It works well, and really the lifestyle is fairly normal. Some of the prosthetic designs of the feet have come a long way. This is it's hard to see it. It's a carbon fiber. I don't know if I can get this off yet. Kind of like a diving board, okay? So as somebody steps down, they load this spring. It bends, and it provides an energy return. So now that the limb has been amputated, they don't have the muscles like you and I do in the calf to propel themselves forward. So by loading this spring, it's going to help propel them forward. And these made a lot of good press, the runners and things like that. The technologies, it works well. We've done studies where people consume less energy walking on a foot like this. So I'm going to pass around. When a body part's missing, trying to simulate the body motion is difficult. And this kind of simulates, this is a foot we can buy that simulates a human ankle motion, because when you walk on flat ground, you basically have to worry about heel strike. When you land, you heel, you get that motion, and then you have to come over the ankle. So this kind of simulates your foot motion. I'll just start passing stuff around so you guys can play with it. Now, a lot of people will see somebody on TV or know somebody that has an artificial limb, and they might be at this level. like I said, they do very well below the knee. When you start to come above the knee, the complexity goes much higher. It's kind of, trying to give you a good analogy. Corvette versus a Chevy Cavalier. They're both cars, but the Corvette's going to be a lot faster and take a corner much quicker. But it's kind of similar to prosthetics. This is a prosthesis. The level of complexity goes up much higher. So technology I had mentioned has advanced a lot. The knee is a very complicated, the process of walking is incredibly complicated. They call that gait. And there's people that just specialize in gait analysis. And to do my job, you have to understand what's happening with the human body when you walk. When an individual lands on their heel, it needs to know to lock. This particular knee joint actually has a computer in it. It's going to read the range of motion of the knee joint. And it has 4 sensors in this pylon down here that knows whether the load is on the toe or the load is on the heel. Because every time we step down in this position, heel strike, there's a ground reaction force coming up from the ground that's trying to bend this knee. So when we land down, our muscles control our knee. If you didn't have the muscle structure, you just had a joint there, you'd step down, boom, you'd fall. So the microprocessor technology has changed this leaps and bounds. This is a fairly basic design that's been around for about 15 years. Some of the newer ones have a gyroscope in them, which know the attitude in space. And the computer's taking readings milliseconds at a time, so it can determine if the knee is safe to unlock or not. So the right technology can help people walk. Pretty amazing. Some people lead a fairly normal lifestyle. I would say with a below the knee or transtibial amputation, life is fairly normal. It's the analogy I can give you. It's kind of like if you need glasses to see, once you put the glasses on, life's pretty normal. It's kind of how below the knee is. You know, people can climb ladders, they can climb stairs, they can do pretty much whatever they did before the little training. I got to kind of keep in mind, I get some elderly people that come in sometimes and they'll say, well, I saw so-and-so on TV and they were running. So the first thing I'll ask them, did you run last year? No. So the prosthesis isn't going to make you do that. You see a lot of these guys that are athletes, they've either, one of the guys I know, for example, he was a pro soccer player almost, was going to sign a contract in a couple days. He got a flat tire. He's changing his flat tire in his car on the road. Became below the knee amputee. He ended up being a Paralympic athlete. So you got to realize some of these people were athletes before, so it's not necessarily the prosthesis that's going to do it. Okay, so that's kind of a perception we see a lot in the, on TV. You know, it makes good press, but that's you got to kind of take into picture the whole person. Yeah, no problem. So different levels: hip disarticulation, partial hands. Upper extremities difficult. To replace this is very hard. We're wearing a prosthesis to walk on is much simpler. And when you get into upper extremity, you get into all sorts of different issues. You get into cosmetic issues that are a big concern. Functional. This is a cosmetic. It has no functional ability to evolve, maybe except paperweight. But it's just for looks. Very typical prosthesis, been around a long time, is a body power. And people wear a harness around their, what's called their sound side, their other shoulder. And by shoulder excursion movements, they'll actually pull on the cable. Some people call it hooks, they'll call the hook today. Doesn't look pretty, but functionally they work pretty well. A lot of people, I have a gentleman, I just fit with one. He lost his arm in a scrapyard accident. I don't know if you've ever been to a scrapyard. These huge machines that chop up the metal. And unfortunately got his arm in that. But he's like, my life is so much easier. I said, well, just give me an example. He goes, just washing dishes. He goes, to wash a cup, because I have to hold it in between my legs and wash the cup. He goes, now I can hold it with a prosthesis and wash it in the sink like a normal person. Just little things like that, make a big change in somebody's life. So that's body powered. Now myoelectrics, they've come a long way. Basically, it's a battery pack, electric motor in hand, and they, by movements typically, there's other ways to operate these. Basically there's a switch, I'm going to simplify it, to open it, and there's a switch to close it. When we fire our muscles, let's say I lost my hand, the muscle's still there, so when I go to extend that wrist, the muscle's there, so we pick up that signal to open, and that's usually how we open a hand, and to close it's the reverse. We'll usually get the muscle belly here. This one's broken, but it's enough I can show you kind of what's going on. So this would be a sensor inside. They put their arm in here, what's left of it, and they hit the sensor by firing your muscles. Okay? The pinch forces on this is pretty good. I had a teenager helping me out. He thought it'd be funny to put it on his nose. He wasn't laughing after he did it. Yeah, they make attachments that go on here that are like they don't look like a hand. They're called a greifer. They're a work tool, and oh boy, they will really hurt if they pinch it. But still have a long ways to go. There's a lot of press about that. Just the hand is such a complicated design. There's so many different grasps that a hand can do. You got pinch, you got three-jaw chuck, you got cylindrical when you grab a baseball. To replicate that, there are some hands on the market, but they still got a ways to go. And then the thumb is, I don't know if you've ever seen anybody, you don't want to lose your thumb. The thumb is so important, just for grasp. So this one here would be, this gentleman, basically it's right up here. He's almost a shoulder dysartic. Technically he has a humerus left, but he's so short we have to fit him as a shoulder dysartic. Arms they're tough, because they're just, to try and replicate what the human body can do is very hard. So going into orthotics, I'm going to kind of go through this kind of quick because it's probably not as exciting. Bracing, this is very typical. This is for somebody that has like foot drop. Now foot drop is caused by a couple things. It could be a trauma, they could have had damage to a nerve. It could have been surgery. They could have had back surgery and a nerve got pinched or compressed or cut. They could have a disease like MS and they lose control of their feet. So they'll need a brace to walk. Make a lot of these. A lot of people out there in the public that are wearing these, you probably never noticed they have them underneath their clothes. Foot orthotics, I'm sure everyone's heard of that. Those are arch supports. Pretty typical. You got a lot of people with flat feet, a lot of problems walking, back pain, ankle pain, leg pain, so we'll try and correct them. Knee braces. I had a bad ACL injury skiing. Had to have my ACL reconstructed, and I wore a knee brace like this for a while. You'll see older people that will have osteoarthritis, all the great stuff as we get older that sets in, and the joints start to change, and weight's a factor, so if you keep your weight in check, you're not going to, most likely your joints are going to last longer, so another reason for a lifestyle choice. A long leg brace would be for a variety of reasons. Typically, when we see one like this, someone's had a stroke, they've had a bad, I don't know, maybe a nerve severed or things like that, and they can't control their knee, so we'll have to fit them with this. Believe it or not, sometimes it's better from a functional standpoint to lose part of a limb. We can treat it better from a functional standpoint. I know it's hard to understand, but sometimes if you have a foot in the way that's not working, you're much better off having a prosthesis at this level from a functional point of view. I've even seen people decide to have their foot removed. They elect just have it amputated so you can fit me like this. Life goes back to pretty normal. But that's a big decision to have a part of your body amputated. I can only encourage people from a functional point of view. That's something they have to decide on their own. So, careers. You could be a technician. You could learn how to make these. Technician path is education. There's some associate degrees, and there's some schools around. We're such a small field. There's not many schools, so you're going to have to travel for that. An assistant, you'd assist somebody like myself. I'd be called a clinician. So that's something that's kind of like the nursing field. You have LPNs now, which are huge, helping the RNs. LPNs haven't been around that long, have they?
Oh, now I'm gonna have them Google as a
Yeah.
extra credit at some
I mean,
point.
I
but
always
yeah.
remember traditionally as an RN, and then LPNs,
Yeah.
I don't know what point. So, assistants, lower education level, associate degree typically, but a big role, place to start. The thing is, you know, you just can't leave high school and start, say, where I am in my career, or she's in her career. But, you know, I did different jobs along the way, just you can ladder yourself up. Some workplaces that you might work. I worked at a hospital. Typically a hospital environment, if you're going to work, there's going to be nonprofit, it's going to be the VA, something like that. If you worked in a private clinic, you could work like at a facility I have. You could work in research. You could work in sales. I mean, there's plenty of people that are, you know, selling these devices. This is all purchased. We just make the upper part, okay? So there's a lot of different avenues within this field if you want to go. If you want to go the clinician route, there's two credentialing organizations that you can get credentialed under. One would be BOC, the other one's ABC. ABC is the kind of the cream of the crop.
What does it stand for? I'm sorry.
ABC is American Board for Certification, so their website, if anybody wants it, is abcop.org.
I'll write that up on the board later. Okay.
And BOC is bocusa.org. Something I did today that's kind of fun. Who's adventurous and wants to try some prosthetics to simulate? Okay.
Mariah over here. Good volunteer.
And strapping these on.
Very cool. Oh, so you have a foot. Okay, so she
What's that foot you have?
she wants to avoid any
Oh, you'll be fine. So I made these up for, can you leave it on?
Yeah.
We can try. Let's see if it fits. I think we'll get in there.
So do you need spotters on either side?
She's gonna need spotters, I think.
So how about tall volunteers?
So, I did a presentation for my children, my son's school. I don't know, let's see if I can get this. Is that too tight? You all right? Okay. And I had the kids walk around on this
Oh, awesome idea.
to appreciate how difficult it is walking with a prosthesis.
What? She has one right now.
She has one?
Yeah.
Okay, what level?
I don't know. It looks like, it has the little thing that slides on, and then it's just like, plastic.
Does she have her knee joint though?
I think so.
Yeah, okay. So this is kind of what it's gonna feel like, what your friend has to deal with.
She's gonna stand up.
Yeah, she'll need some help because she's gonna be tall.
Do you guys both mind? Cameron, you don't want to do a spotter? Okay, so Brooklyn and Lauren, thanks for volunteering. You just have to be there on either side. That's okay.
No, I'm gonna feel so tall.
You're gonna feel really tall. How much taller is she gonna be?
How tall are you?
I'm 4'11".
Alright, so now you're gonna be like 5'10"?
Seriously? God, I'm gonna be the height of my boyfriend.
What a great, so you created this to just demonstrate what it would feel like?
Exactly.
Okay, this is pretty cool.
So,
So you have,
and just to show, I mean, you can see how
This is
she
awesome.
walks around without them, and you're going to see quite a difference when she tries to walk with them. So,
Oh God.
all right,
Wait, let's just pause. You get this on snap.
I got it.
okay, so over here. Okay. Okay, so can she, go help, go help. I gotta move back, you're tall.
got this. Hold
Brooklyn,
on.
can you be on the other side? Just be on the, just be behind her or something, yeah.
Actually, she's doing pretty good.
I got
You
it.
know what, young kids
The
can,
younger kids
yeah.
are hysterical.
Let me, oh my
Take a
goodness.
picture on my phone, yo.
Somebody take a picture of her? Can you wave? You're gonna be on,
No, you didn't. No, you gotta do it on my phone.
what does it feel like?
It feels like, I don't know. Oh,
Does it-
hey. I don't know. It feels weird. Like, you feel like,
Oh, that's on me.
I don't know. I wouldn't be able to do this.
But you can walk with those 2 feet. That's
Yeah, but, like,
amazing.
you feel so, like, unstable. Like,
Okay, a little bit unstable. Okay.
Yeah.
So Brooklyn's gonna follow you from behind. Brooklyn, just follow her, just in case
where
she's.
am I going?
You're just walking, and we're getting you on video, and everybody can see what it looks like. Thank you, Brooklyn. I appreciate it.
You're gonna have to, no, don't do that.
So are you taking
Yeah.
smaller steps?
Yes?
Smaller steps.
Okay.
Wider base of support, it looks like.
You're my feet too.
But it doesn't feel too bad, right?
You like being 5'10"? I'm 5'9",
Yes.
so you're at least 5'10".
Oh wow! And you
Love
look
it.
at that. She can. Thank you very much. Wow, she's very adaptable.
So-
All right.
I mean, what are your thoughts? It's not easy, is it?
No, I cannot do that. I feel unstable.
So losing 2 limbs obviously is harder than losing 1. But it's possible. I mean, with some training,
It's hot in these things.
prosthetics are very hot. That is a complaint we get.
Oh, I wouldn't have known that. Okay.
Yeah, very hot. And here's the other problem wearing a prosthesis. The vast majority of our sweat pores are in our palms or our hands and our feet. So if you lose 2 limbs, you'll see a bilateral amputee. They'll perspire a lot.
Oh,
I have a
okay.
gentleman that he'll change his t-shirt a couple times a day.
Oh,
He just perspires so much. We don't realize how much our body regulates our heat through those, limbs.
We just get a good view of this. What a great design. Okay. Yeah. Absolutely. Thank you for asking. Mariah, thank you for demonstrating. That was perfect.
Yeah, little kids that.
Oh, I can only
Class
imagine.
wanted to try it,
Oh, I
so
could totally see that.
we
Yeah.
didn't have time for it. But
Okay.
if anybody else wants to try it, feel free.
Does anybody know anybody who's got a prosthetic? Family members? Family members?
What?
Does anybody have a family member or a friend, or they've seen it before? You've seen these before, right? Okay. All right.
Unfortunately, a lot of people find out of our industry either from personal experience or a family member. I have some resources I can leave with you
Excellent.
beyond just the credentialing bodies. If this is something you think you're interested in, I do a job shadow on a case-by-case basis. So usually I'll have sometimes guidance counselors
Yeah.
contact me, and we'll just pick a day, and someone will follow me around for a few hours. So if it's something you think you want to do, we can try and set that up.
I'm very excited to hear that because these students need it, job shadow, and they would love to.
And what grade are you guys?
11.
Around another year or 2?
Yeah.
Okay. I have a gentleman now he's a senior. He helps me out a couple days a week. So, something to keep in mind too.
Does he intend to be a clinician, or what is his?
His family wants him to be a doctor. They're all doctors.
Okay.
But he doesn't want to be a doctor.
Okay. So maybe he'll go into research.
I don't know what I'm trying, I'm
Yeah.
trying to, maybe see some things, about this field. Look, the thing is, whatever you do for work, you better enjoy it, because you're going to spend a lot of time of your life there. You're going to spend more time there than your friends or family. So make sure you pick something you like. It helps too if you pick something you can make a decent living, so you're not struggling. So, I guess I kind of flew through that a little quicker than I thought, but we got plenty of time for questions or whatever you guys want to talk about. Yes?
What do you want to be in high school?
What do I want
What
to
do
be?
you want to be in high school?
What did I want to be?
Yeah, what did you want to be when you were in high school? What they are?
Well, I started as an aircraft mechanic, so very mechanical mind. I like fixing things, so that's kind of the route I was going down at that time. So it's all right if you don't know what you want to do. I wake up some mornings, I'm not sure what I want to do. Just keep pressing forward. Yes.
What do you like best and worst about your job?
The best thing about my job is getting somebody up for their first time that thinks their life is over and they start walking. I mean, I've seen grown men break down like little babies crying. It's amazing. So sometimes I see some pretty emotional things. Probably the worst part about my job is just the bureaucracy I have to deal with as a business owner. It depends what part of the career you pick in this field. One of the reasons I picked this field is I've always kind of been self-employed. Put myself through college with a landscaping business, things like that, and I like that avenue. So one of the things that attracted me to this career was the ability to possibly work for myself. So that was important for me. It's good questions. Anybody else?
When you mentioned programs that there's limited, is there anything in the area that you know of
Matter
that?
of fact, there is. Yeah.
Excellent, okay. So
University of Hartford.
University of Hartford.
They have a
okay.
master's program. So it's relatively, it's part of the program I started from. When I went through the program, it was 93, and it was at the time, Connecticut Children's Medical Center had a certificate program at the hospital. That's where my sister worked. That's how I found out about it. So you had to have a undergrad degree, which I had in aerospace. It was a postgraduate program. That program is now kind of morphed into the University of Hartford's taken it over, and it's a master's program. I was looking briefly last night. I'm not an expert on education pathways. It's been a while since I've been out of it. BOC and ABC, I believe, are still undergraduate programs, but they require some specified training. So you're basically looking at 6 years total.
Okay.
You know, 4 years undergrad, 2 years of postgraduate, if you want to do it that way. So, and there's ways to do it. I'm not sure on this, but I think the Air Force and possibly Navy have a program. So something to consider too. You know, if you don't have the resources, I didn't have the resources to go to school right away. Had some to get my aircraft training, but I ended up working for Pratt & Whitney, and they paid for my schooling later. So what I'm getting at is if you don't have it, there's many ways to do it. You can do military, you can do maybe get in with a big company, have them help pay for it. And I was on like on the 10-year plan. It wasn't 4 years of college and done. I worked and went to school. So yes.
What does your typical work week look like?
Work week, not 9 to 5. I'm a business owner, so typically I'll see patients throughout the day, and that could be evaluation. That could be the fabrication of the device. It could be repairs. The one thing I tell people when they consider who they go to for an artificial limb, keep in mind this is a lifelong thing. This is like a relationship with a dentist. Your body's going to change. You're going to get heavier, you're going to lose weight, your limb will atrophy, components will break. The human body is so tough, repairing itself, it's amazing the way I see some of these come back broken. So when I say adjustments, you got adjustments and repairs. So you're seeing these people, some more than others, some, you know, I have individuals too. Amputees are kind of weird in a way that some of them just, They wait till it's absolutely destroyed before they call you. And they come into your office and you're like, what am I gonna do with this? So you get that side of the coin, or you get people that are more frequent. So, and then I gotta order supplies. I'm involved in making some of it. It's really not my best time spent, but sometimes I get involved making them. I know how to make all these. And then just day-to-day paperwork for part of my job, I don't care for. Probably like, it's a lot to your job, you'd
I
rather
have to
just
say, out of
teach.
all the speakers we've had, everybody has said, have you guys noticed that the theme, the paperwork is their least favorite? Yeah, it's a trend.
I gotta do it if I want to get paid.
Yeah.
So, it's just the reality of it. So learn how to, write papers and read and spell. Thankfully, a spell check. English is not my strong suit. But whatever you pick for an education level, the higher you go up, the probably more paperwork, unfortunately, you're going to have to do. Okay.
I'm just trying to make sure everybody's
Yeah.
So any other questions? So where do they make them? Is there anywhere locally? When you
Yeah,
say you send
there's two trends. Traditionally, the industry, everything would be housed under one facility. It'd make everything. Industry has changed, and now we use a lot of central fab. It's probably no different, probably like a dental practice used to make a lot of the crowns and the tooth. Now they just ship them out the labs. In our industry too, a lot of the stuff is toxic. The chemicals and you can see in this socket here, actually this one's better. This is carbon fiber, this black material. Very strong, but very hazardous to breathe. You gotta have respiratory stuff. Under a microscope, the fibers look like a fish hook. So if you breathe them in, they'll stay in your lung, they won't come out. So you gotta have specialized equipment to work on some of this stuff. They've gotten better. Some of the resins and things like that I use some that are non-toxic. They have no odor. We used to use a resin that would stink out the whole office if I used it there. So the labs have, one of the reasons they've increased is just because of the materials and the ventilation and all those issues. We make a lot of the simple stuff on site. The plastics have no toxicity to them. They don't smell. Easy to, you don't have the respiratory issues. So we'll make a lot of the simple stuff. The complex stuff, the way this is made, any of this material, is basically you have a mold, and over the mold you pull these, like a sock. It'd be made out of fiberglass, it'd be made out of carbon fiber. You pull it over the mold, till you get the number of layers you want, and then you put a bag over, it's called a PVA bag, and under vacuum you inject a resin, and it fills all the different fibers and socks. You ever seen fiberglass, but if it's not in a resin form, it just looks like a piece of cloth. Once you put a resin in it, it gets solidified and strong. So that's kind of the process of that. When we make a brace like this, it's pulled over a mold in a person's limb, but it's a flat piece of plastic when we start. We put it in an oven, and it gets like cellophane almost. We pull it under a vacuum. So kind of neat. I enjoy making the stuff to some degree. I get to work with my hands. So if you want to work in this field, obviously you got to be a people person. If you want to be successful, you got to like people. You got to deal with their issues. Everyone's got them. And you got to be a problem solver. You got to understand how the human body works, walking, and you're correcting a problem, either taking account for parts of the body that aren't working or aren't there.
So as you're developing this, I see the foot size is different here versus here. And so are you accounting for how tall they are, and they have to, is it?
Sure. If they're a single-sided for lower limb, or even upper limb, you'll take measurements off the sound or the unaffected side. If they're bilateral, you will take measurements sometimes. There's charts that were developed years ago. Basically, if you take the wingspan of a person tip to tip, that typically is their height. They'll figure it out that way. But you may want to lower them down for stability reasons. So, you know, I'm 5'9". If I was to lose both my legs, I don't think I'd want to be Michael Jordan's height because the balance I'm not used to it. And they might, you know, who knows? It depends. Maybe I'd be 5'7" just so I could walk and not be, you know, unstable. So.
So how about I turn off the camera and can we have them just come up and ask individual questions?
Sure.
But before we do that, I just want to tell you, first of all, thank you for coming in. This has been more than, this has exceeded my expectations. Hello, Ms. Langford. Hey, good. I've got a speaker here today. So fun. I've got to show you the video later. Eric is not in class. No, that's fine. If he comes in, everyone will have 5 more minutes, and I'll send him home. Thank you, ma'am. Okay. All right. But, so, thank you for coming. We love the speakers. When I polled my students, this is their favorite part of the class. And so we will probably do some form of an extension of this. But I just want to tell you thank you from the behalf of not just this class, but the 4 other classes who will get to
All right,
see
welcome.
this.
So the other classes are going to see the video?
Yeah, I have it on
Okay,
my
cool.
Chromebook, so it's very good. But I want to tell them thank you very much. So we'd like to give them a round of applause. And I'll turn off the camera.
I'm going to give you